One of the biggest misconceptions about stroke is that people aren't aware that it actually occurs in the brain. A lot of people, and I think I think it comes from the fact that the Heart and Stroke Foundation have combined together, and so people sometimes think that the stroke actually occurs in the heart, or they're not really sure where it's happening. So we do want to let people know that stroke actually is a brain injury. It's just a brain injury that happens from inside the blood vessel wall, bleeding, or the interruption of blood supply to the blood tissue or to the brain tissue itself, as opposed to a traumatic event, something like a car accident or where people have been hit on the head. But it is in fact a brain injury, and can impact all of the areas of the body that a brain controls, which is basically all of them. One of the other common misconceptions is that stroke is an old person's disease. And although your risk for stroke does increase as you age, what we're unfortunately seeing is stroke is happening in younger and younger people. And this is a combination of poor lifestyle choices that we're making. Our culture tends to sit too much. We tend to eat the wrong things. We don't exercise. We don't pay attention to our health. And we drink too much. We have too much stress. And all of these things increase our risk for stroke. So, you know, when I started at the Glenrose, if we had a 30-year-old with a stroke or a 25-year-old with a stroke, it was a big deal. We had, you know, people would bring their students to come up and see this young stroke survivor. It's not, unfortunately, it's not uncommon at all now. And we're seeing strokes in their 20s, in their 30s, that actually we didn't tend to see so much of, 20, 30 years ago. So it's becoming a younger person's disease with every year. Well, I think as a culture, we tend, as a North American culture, we have a diet that's way too high in fat, in salt, and just generally we're eating too much. We're eating the wrong things and we're eating too much of them. We're not eating sort of a healthy diet. We put way too much salt on things. We tend to, like the Americans, tend to have higher fat in their diet. We have, as Canadians, we've become a lot of sort of fat conscious. We tend to watch those fat grams, but what's happened is, in order to make it taste better, we've added salt to it. So we've taken out the fat and we've added the salt, and unfortunately that also has risk factors of its own. It tends to increase our blood pressure, which is the #1 risk for stroke. And then we end up with an increased risk for stroke anyway. So as a culture, we sit way too much. We tend to drive our cars to our jobs. We park nice and close to the entrance because it's cold outside and we don't want to be out there very long. We then take the elevator up to our office where we sit at our desks for 8 hours a day. We then do the same to get home. Sometimes we have kids who are in activities, so we watch them exercise while we're sitting on a bench drinking our coffee. And then, we take the car home and sit in front of the TV for the rest of the evening. So all of that time that we spent just sitting and being inactive also impacts our health. And then you look at the stresses that we're under, and when we tend to get stressed, we tend to fall back to unhealthy coping mechanisms. We smoke, we drink, we go and grab a hamburger because we don't have time to make dinner and make a proper one, so we'll just grab something fast food on the way home. And all of these things just add up, and over time it really impact our health and put us at risk for not just stroke but heart attack and a number of other sort of chronic health conditions. FAST is a campaign that Heart and Stroke have put forward to help people recognize the signs and symptoms of stroke and then to know what to do. So it's an acronym, FAST. The F stands for face, which you then look and see, is one side of that person's face drooping? Do they suddenly look asymmetrical? You're sort of looking at them and all of a sudden one side of the face kind of sags and it looks very odd. A is for arms. Can they raise both arms over their head equally? Or is one arm weaker? One arm goes up and the other arm, they can't lift it very high. S stands for speech. Are they having trouble with their speech? And this can be either all of a sudden they're looking at you, they're not understanding what you're saying, Or it can be that their speech is jarbled. It can be that it sounds like they have a mouthful of marbles and they can't talk properly, or the words that they're saying are not making sense. And so, either of those is a clue that something is desperately wrong. So any of those signs and symptoms could be a stroke. And so what we want people to do is to act fast. T is for time. For every minute that people wait to get treatment, they're losing 1.9 million brain cells. And so time really is brain. The faster you can get them into the hospital to get treatment, the more brain cells you save. And the way to get people into hospital is by calling an ambulance. We do not want people, a lot of them just bundle them into their car and drive them to whatever hospital is closest. But unfortunately, stroke treatment with a clot-busting drug called TPA is a very dangerous treatment. It can only be done in very specific hospitals. In Edmonton, the U of A and the Grey Nuns are the two hospitals that can provide it. And so if you call an ambulance, there's a lot of steps that they can do before the person even arrives at hospital that decreases the time and cuts it short, so that as soon as they get to hospital, they can get that CT scan done to know whether it's a bleed or a ischemic stroke, which is what a clot-busting drug can work on, and they can get that treatment done as soon as possible. It's time that's really of the essence. There's two main messages that I want people to know. One is to know what the signs and symptoms are of stroke and to call 911. And we're behind the 8 ball with that. In terms of heart attack, if somebody clutches their chest, 30 people are phoning for an ambulance. If they're saying they have chest pain, 30 people are calling an ambulance. We want the same reaction for stroke signs and symptoms, and we need some catch-up work there. A lot of people still tend to bundle their loved one home and put them to bed and see how they do in the morning. And by the morning, it's too late. That brain damage has been done, and there's nothing we can do at that point in order to treat it. So we want people to act fast and to get their family member into the hospital or call 911. The other thing is that there is hope. Stroke is preventable. 80% of strokes can be prevented simply by changing your lifestyle, monitoring your health, and taking a serious look at how are you doing. Go see your family doctor, and I know men are especially hard to get to go see a doctor on a regular basis. I'm fine, I feel great. Well, the problem is that most of the risk factors for stroke don't come with an obvious sign. I can't look at you and tell you that you have high blood pressure or that you have high cholesterol or that tomorrow you're going to have a stroke because you're so high stressed and your lifestyle is such that it puts you at risk for that. So most of those things can only be done with a doctor, doing regular checkups, regular blood tests, regular blood pressure monitoring. And these things can all change over time. They need to be monitored on a regular basis. And with simple lifestyle choices, getting more exercise, eating well, decreasing your stress, you can prevent 80% of the strokes that are happening in Canada right now.